all, this is Dr. Reshmi. In this video, we are going to see about preconceptional counseling. So what is preconceptional counseling? A set of interventions that aims to identify and modify biomedical, social and behavioral risks to a woman's health or pregnancy outcome through prevention and management is called as preconceptional counseling. What is the importance of preconceptional counseling? It reduces the maternal mortality and morbidity. It also prevents premature birth, low birth weight babies and also neonatal mortality. Timing. When a couple is planning for pregnancy, it is an ideal time to get their preconceptional counseling done. So, other indications include any visit to a doctor in reproductive years, infertility treatment, premarital counseling when urine pregnancy test is negative. Goals. The couple should always get them screened for high-risk factors like diabetes, hypertension, cardiac diseases, hypothyroid. Also, the following history has to be taken in detail: medical and surgical history, previous pregnancy history, family history, personal history, physical examination of both the couple should be done, and also laboratory screening tests also should be done. Preventive health. The patient can be started on tablet folic acid 400 microgram per day. It can be started 4 weeks prior to conception till 12 weeks of pregnancy. It reduces the neural tube defects and also helps in proper brain growth for the baby. Higher doses of folic acid will be required in two conditions: when the patient is on anti-epileptic drugs as well as in case of previous history of neural tube defects. Weight reduction in overweight and obese patients helps to reduce the neural tube defects, helps the patient not to be prone for diabetes and hypertension, and also reduces the chance of cesarean section. Correction of anemia is also required. So vaccination. Hepatitis B vaccination for all women at risk should be given. Rubella vaccine prevents congenital rubella syndrome. The most important thing is live vaccines are always contraindicated during pregnancy. Screening and treatment of infections. The couple should be screened for the following: HIV screening, screening and treatment of sexually transmitted diseases. It reduces the risk of ectopic and infertility, reduces preterm birth and premature rupture of membranes, and also reduces the chances of neonatal sepsis. So these are the chronic medical illness. So in these conditions, if the couple is having these conditions, they should always go and meet their doctor and they should review their medications. In case of anti-epileptic drugs, change to less teratogenic drugs. In case of diabetes, maintain HbA1c less than 6 and the patient should be started on OHA, which means oral hypoglycemic agents or insulin. In case of hypothyroidism, thyroxine supplementation should be started. In case of hyperthyroidism, prefer propylthiouracil to carbimazole. In case of cardiac diseases, rule out conditions where pregnancy is contraindicated, and if the patient is on warfarin, the patient should be changed to heparin. In case of carcinoma, fertility preservation options should be offered prior to the therapy. So recurrent pregnancy loss. So the couple should be screened for antiphospholipid antibody syndrome and congenital thrombophilias. Correction of uterine septum and removal of fibroid can also help the patient in conceiving if the patient is having these conditions. Addictions: no smoking and stop alcohol before and during pregnancy. Teratogenicity. So what is a teratogen? A teratogen causes permanent alteration in the structure or function of an organ acting during embryonic or fetal life. So these are few teratogenic drugs which should be contraindicated in pregnancy, and in case if the patient has taken these drugs, this can cause these abnormalities. So in case of thalidomide, multiple defects can be seen to the baby. In case of diethyl stilbestrol, vaginal adenosis can be seen. In case of phenytoin, fetal hydantoin syndrome, high doses of aspirin, especially in the last trimester, causes patent ductus arteriosus and pulmonary hypoplasia. Intake of cocaine causes congenital anomalies and also can lead to abortions. High dose of steroids can lead to intrauterine growth restriction. Isotretinoin can cause cardiac and CNS defects. ACE inhibitors can cause some respiratory problem to the baby. All live vaccines are teratogenic and hence it is contraindicated. Smoking causes placenta previa, abruption and IUGR. Intake of alcohol causes fetal alcohol syndrome and intrauterine growth restriction. Thank you. Please like, share and subscribe if you like this video.